See, I strongly believe in the fact that prevention is always better than cure. So there are a lot of factors which lead to cancers, breast cancers, and when we talk of prevention, we need to begin with controlling the risk factors. Not all of them can be controlled by us, but if we go cancer by cancer, we have to try and focus on the factors which can be controlled. For example, if you talk of breast cancers are seen higher in women who are overweight. They have a late age at their first pregnancy, they have fewer number of children who have been on hormonal pills. If the body weight is not in right proportion, that is the waist to hip ratio, that is high, such women will have higher risks of breast cancers. Sometimes it could be in the genes, or maybe the lifestyle or the kind of diet they have, lack of physical exercise. Sometimes it could be because of hormones which are taken, prescribed either for some treatment, or sometimes people go ahead with self-medication. So these patients are going to be at a higher risk. Now a lot of it would be combined together in an urban lifestyle, which kind of explains the reason that the percentage of breast cancers in India is rising. Of these factors, the factors which can be controlled or regulated would be regulating the weight, regular exercises, not indulging into taking hormone medication on your own or any over-the-counter hormonal medicines to be taken. As far as the first stage of pregnancy or number of children, of course there are multiple factors involved, but yes, late age, fewer children and not breastfeeding are factors which increase the risk of breast cancers. If you talk of cervical cancers, the common reasons for that would be the early age at which there is the first sexual encounter. So it is very common in the uneducated or in the rural areas where women are married off very early. So in India, the divide is that towards the more urbanized society you would find more of breast cancers, and towards the more rural or uneducated society you will find more cervical cancers. Apart from that, having multiple sexual partners, having multiple pregnancies, being very young at the time of the first child, having a low hygiene, there are certain infections which are transmitted like HPV. These are the factors which would lead to development of cancers. So what of these could be avoided is that, number one, there is a vaccine for cervical cancer which is very, very effective. So that needs to be given to the girls at pubertal age, at a very young age. So using the vaccines and trying to avoid these factors as many as possible, using barrier contraceptives like condoms to prevent the spread of infection. And one king rule or thumb rule for all cancer avoidance is to avoid tobacco in any form. That is actually the worst thing that you can do to your body. As for ovarian cancers, there are not a lot of factors that can be controlled or regulated or modified by us apart from hormonal manipulations. Otherwise, other than that, there are factors like genetic factors, family history, or endometriosis and things which are beyond the scope of modification from our side.